Hello, everybody. Good afternoon, and welcome to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. James Bridgers, who is our Acting Health Officer, as well as Dr. Earl Stoddard, the Assistant Chief Administrative Officer, and Sean O'Donnell, Program Administrator, Public Health Emergency Preparedness and Response from the Department of Health and Human Services, is also joining us today. Reporters, all of you should already have permission to record. If you do not, please use the chat to request it. And let's get started. Mr. County Executive, you're not Barry Hudson, you are Marc Elrich. Good afternoon.
Good afternoon. I'm having trouble keeping stuff on my screen. Jesus. Hold on. I'm going to have to, is this from Word? Okay. So, a little technical difficulties here. So this week, I'm talking to you from Leisure World, where we're going to be hosting our 7th budget forum. This season, we conducted 5 budget sessions in each of the regions, and we conducted one in Spanish for Latino community, and this one, which is being focused on our older residents. These budget forums have been nice opportunities for us to not only provide background and context for our upcoming budget, but also to listen and hear the priorities and concerns of the residents in the community. And I went to Leisure World. I want to thank them for hosting us today, and I look forward to our budget forum this afternoon. On the COVID update, as for this week, the United States passed a rather grim milestone. We hit 800,000 deaths nationwide from COVID. This number accounts for 15% of the world's total fatalities from this virus, even though this country is only about 4% of the global population. Even sadder is that despite the rollout of vaccines, the pace of COVID deaths has increased. It took 119 days to go from 600 to 700,000 fatalities. It only took 74 days to go from 700,000 to 800,000 fatalities. And just as a reference point, the 100,000 increase in fatalities in 74 days is multiples of the number of flu deaths that we experience in a year. So in case anybody's confused about whether this is just like the flu, it's not. Our 7-day death rate in the United States has increased 27.8% from the week before. And as one of the world's wealthiest and most educated and technologically advanced countries, with an ample supply of vaccines, these figures are truly tragic, and they're really representative of the stubborn unwillingness of some people to get vaccinated. We're doing better in Montgomery County compared to the rest of the nation. We see that another winter surge in cases is definitely upon us. The state's database has been unavailable for 10 days because they got hacked, and they're not able to provide us the information. We started getting a trickle of additional information in the last day or so, but we do not have the normal case rates per 100,000 and the other data that we're used to being able to provide you. But we do have some data, and these numbers are, numbers we do have are headed in the wrong direction. Across the state, hospitalizations have increased 44% since December 3rd. And Montgomery County's hospitalization rates are as high as they were back in mid-April of this year. Remember, that's when things were like really bad. Maryland active COVID outbreaks. We have 253 outbreaks in schools, up 41% from the prior week, 107 in nursing homes, up 19%. Assisted living centers, 57 outbreaks, up 16%. Childcare, 54 outbreaks, up 42%, and group homes, 46 outbreaks, up 24%. There's been a 29% outbreaks statewide and a 41% increase in school and childcare outbreaks, and we're seeing the same impact on Montgomery County. County schools has had the same number of COVID cases in the school last week as we had in the entire first 2.5 months. Between Saturday, December 4th and Sunday, December 12th, there were 518 new COVID cases. For comparison purposes, there were 1,036 total cases in MCPS from the beginning of the school year till November 19th. So our cases are clearly increasing. I applaud the recommendation by our HHS department and the decision by MCPS to pause sports for 14 days in schools with outbreaks, and it'll be further assessed if necessary due to the increased cases reported for high schools and per the recommendation of the Maryland Department of Health. This recommendation is based on an earlier recommendation by the CDC that the suppressed person-to-person or close contact spread. They wanted a 14-day pause in these activities. Currently, Montgomery County's Board of Health mask mandate remains in effect and should be with us throughout the rest of the year. However, the mask mandate is scheduled to sunset once the county hits 85% of our population fully vaccinated, and we're currently at 82%. It is quite possible we will hit the 85% number by the end of the year. We've asked for the council to convene as the Board of Health to talk about this, because the 85% number was predicated on the notion that that was herd immunity. And if you have a long enough memory, herd immunity was once 70%, then it became 85%. And here we are approaching 85% with no sign that the herd, that means you, me, and our friends, are immune to this. And in fact, what we're seeing is, the virus has continued to mutate. And as it continues to mutate, it continues to infect people. So it's an ongoing problem, but making assumptions about herd immunity is a serious mistake. We won't get to herd immunity when this number becomes 85%, and no one should expect anything magical to happen. This Saturday, we're doing a Super Saturday Boosterama at Westfield Wheaton Montgomery Mall. And we want to make sure that we get more of our residents vaccinated with boosters, and more boosters. We have not fully vaccinated everybody who's due for a booster shot. The booster shots are important because the scientific evidence is showing that even with 2 shots, the efficacy of those shots does begin to wane, and that a booster is necessary to maintain the levels of protection that we want. Boosters may not fully prevent breakthrough cases, but they will help prevent the serious cases. And that's what we need, is the ability to protect ourselves from serious cases of COVID. That's probably the #1 priority. So far, we've administered 267,000 booster doses. And it's good news that 16 and 17-year-olds are now eligible for their boosters as well. But we have hundreds of thousands of residents that are due their booster shots. And we hope they'll come in and get the shots. We have the doses. We can schedule this. We have pharmacies and other providers outside of the county government that have doses. So there are lots of places to get vaccinated. And that's why we're co-hosting with Westfield Wheaton and Saluda Vienna Star this Super Saturday Boosterama. It's Saturday, December 18th. It's going to go from 10 a.m. to 1 p.m. And it provides free COVID-19 boosters to shoppers. First doses to adults will also be available, and there will be no pediatric doses at this event, and no appointment is necessary. Super Saturday is one of the busiest shopping days of the year, and so we're taking our outreach efforts directly to the community. And I want to thank Westfield Wheaton for offering a raffle of mall gift certificates for those who get vaccinated or boosted. And I'm going to be there for a while, and I hope that you'll join me and bring a friend or family member to come and get their shot. In a milestone, we want to make note that our hardworking employees at Montgomery 311 call center, that as of, I guess, this week, they've reached 1 million calls since the pandemic began in March of 2020. That's a lot of calls. Our folks have been, really engaged and, working to make sure they can answer the calls and get people the information they need. 311 obviously provided an easier entry for people into reaching folks. There will always be busy numbers at times, and we'll always, with the load that's coming in, not every answer gets out as quickly as we'd like it to be. But it's a remarkable service and it's a remarkable achievement for our folks in 311. 311 is available from 7 a.m. to 7 p.m. Monday through Friday in many languages. And obviously you get it by just simply calling 311 in Montgomery County or 240-777-0311 from anywhere. And there's 24/7 online at mc311.com, and you can tweet us at 311MC311. So there are multiple ways to reach us, and we will endeavor to make sure we get answers back to you. And in another bit of news outside of the county, but one that affects the county, the state surplus, the Board of Revenue estimates met yesterday to adjust the projections for the current year and for the next budget year. And they announced that they anticipate a $500 million increase in revenue for the state in both the current year and for the next budget year. And that's significant. They're also sitting on extraordinarily high reserves. And one of the things that myself and I know other county executives are asking for help on from the state is to use some of those reserves to help us fund school construction. Our budgets were based on pre-COVID costs for construction. Anybody going out and building now, knows full well that that inflation in building materials has vastly increased the price of construction. I was talking to somebody the other day, and they said that $2.14 2x4 that they bought from a local chain peaked as high as $10. And while it's fallen back into the mid sevens, it's still multiples of what it was before COVID hit. And so these are the kind of expenses that our school system's dealing with, all school systems. And while we don't think budgetary surpluses or one-time budgetary surpluses are good for funding ongoing operations, because there's no promise that you'll have that money the next year, these surpluses are good for capital projects, and they would certainly help all the school systems meet the construction goals that they set, rather than having to reduce construction based on reductions due to increases in costs, which would let them build fewer square feet for the amount of money they have available. And finally, I want to take a moment to note that yesterday was Nancy Kopp's final Board of Revenue Estimates meeting. Her final words at this meeting were, I thank you, and it's been swell. And I want to say on behalf of all the residents of Montgomery County, it's been a lot more than swell to have Nancy Kopp's service to our state, and the better word might have been extraordinary. I want to publicly thank her once again, and we're going to miss having her in Annapolis. And again, thank you for joining me today, and I'm going to turn it over to Dr. Stoddard, Dr. Bridgers, and Sean O'Donnell for their updates, and I look forward to your questions.
Good afternoon, all, and thank you, Mr. County Executive. I'm glad to have the opportunity to attend your weekly press conference. Before Mr. O'Donnell runs through our case count based on the data, Mr. Elrich indicated that there's been about 2 weeks lag in data, but we've implemented strategies to gather data either from our local labs or other entities so that we can maintain a pulse, if you will, on the community level spread of the COVID-19 and or any variants in Montgomery County. But I just wanted to briefly touch on and provide an update regarding our athletic outbreaks, team sports outbreaks in the county. We've had extensive conversations with the Maryland Department of Health and our MCPS partners regarding the outbreaks, the sports related outbreaks. We've determined a 14-day pause, as Mr. Elrich indicated, based on data and the science that was reported or that we're seeing with our epidemiologists from the Centers for Disease Prevention and Control, going back to guidance that they set forth in May, and then more recently guidance that was set forth in October to mitigate any and suppress any further transmission of the virus in school settings or institutions of higher education. And so we continue to work with our MCPS partners. Now, keep in mind, this 14-day pause is subject to change based on ongoing investigation, contact tracing, and case counts. It was a preliminary investigation that we supported, and we guided MCPS to immediately deploy that, along with mask wearing while not participating in the sport. This is done on a case-by-case basis. We have not received any additional information regarding extracurricular activities or other extracurricular activities such as theater or drama. And when they are reported to us, either through MCPS or through our communicable disease and investigation team, we will follow up accordingly and set forth policy and guidance based on those recommendations. Again, we continue to assess any outbreaks with school sports daily and provide that guidance to MCPS in consultation with the Maryland Department of Health and what our investigations are seeing at a local level. So I just wanted to share that with all to keep us on the same page, as I've received many questions, not only about the number of outbreaks, the number of days paused, the recommendation and the rationale for doing that. We know that, as Mr. Elrich indicated and the data and science indicated, that there's a 14-day period for us to not only to assess any ongoing outbreaks, but also allow us to do our contact tracing and investigation to determine if in fact it's community spread, if it happened inter-county play or interstate play, or even in the locker room when folks not wearing masks. So we are taking a deeper dive and looking at the data. We're also not only looking at, we know that they've been in high schools, but the ages that have been impacted, if they were vaccinated versus unvaccinated, and if they are happening in any particular area, zip code in the county. So we're taking a deeper dive in the data to better assess and determine more effective outcomes. I'll stop there and ask Mr. O'Donnell to continue with public health update with the post report that we've prepared.
Thank you, Dr. Bridgers. Thank you for your patience as loaded this up. So again, as has been mentioned, we are getting data now from the state on a number of different areas. And we continue to get data from our partners on hospitalization data. We're still waiting for specific case count data, and that has not come through. However, we have a pretty good idea that where we are as far as direction based on our hospitalization and our positivity rates of county testing. All of these have increased. We've seen, and we've seen that hospitalizations have increased across Maryland. When we look at Montgomery County, we're seeing increases in both our acute care hospitalizations as well as now our ICU hospitalizations have gone up. We're at a census of 147 patients in our facilities that have been identified with COVID as one of their diagnoses. So these have continued to rise since mid-November, and it has plateaued for the last few days, but they have been on a trajectory of increasing. Where we're looking at, well, actually, before I go into the vaccination summary, I wanted to share that we're also looking at our positivity rates, and we've seen those rates go from at county testing sites from about 2.5% positivity in early November. At this point, we are up to about 6.7% positivity at our county sites. We do see that our positivity is a little bit higher than the all county providers collectively, so that those rates will probably be a little bit lower once we have all of the data from our other county providers. But we have seen the positivity rates jump quite significantly over the last month and continue to go up each of the last few days. Within the data, we are now getting updated data on vaccination totals. One thing of note is that the CDC has changed the upper limit for reporting vaccination data. They stop at 95% now to account for potential margins of error in reporting and possibly associate it with the census population data. So that has changed, again, how we'll show these things as we reflect the CDC reports here. Our numbers continue to go up with first doses of our total population, and our fully vaccinated are increasing now as the 5 to 11-year-olds are coming in for their second doses. Our county sites have seen a considerable increase in testing. This is likely both following people's gatherings over Thanksgiving, wanting to be tested, as well as increased testing of our county employees who are coming out to our sites. And to give you a snapshot of where we are with booster doses, inclusive of also doses for immunocompromised, the county has, across all providers, provided more than 272,000 additional doses. And where we're seeing these doses go have been at higher rates for our 65 and older populations and our 50 and over populations. Our populations at the younger ages have come out in much smaller numbers for booster shots. This is statewide data here, but we believe that this is reflected as well in Montgomery County. So as we encourage folks to come out for boosters, we are still strongly encouraging those at higher risk for serious COVID, which is our older populations. But now 16 and above are eligible for boosters. And once they hit 6 months, if they had Pfizer or Moderna, or 2 months with J&J. And so we're encouraging them to come out as well. And we're seeing a good turnout at our clinics for boosters. Within our vaccination tracking for our 5 to 11-year-olds, again, we're continuing to see these numbers go up. We have over 40,000 of our 5 to 11-year-olds vaccinated with at least one dose, and more than 25,000 have become fully vaccinated at this point. We'll continue to do clinics every day of the week offering pediatric vaccine, and we're strongly, again, encouraging parents to bring their kids out to get vaccinated. And then we just wanted to share a little bit of data on the vaccine effectiveness. We know there's a lot of conversations about why to get a booster and waning immunity. Our state partners have shared some information on a number of studies that track vaccine effectiveness with certain populations. And looking at effectiveness against hospitalization, they've shown that the vaccines, at least through October, have remained very effective at preventing severe illness that results in hospitalization. Of course, most of this data is focused on the previous variants, previous COVID illnesses and variants up through Delta. Likely would not include very many Omicron cases in here. As far as effectiveness against getting any sort of infection, as we've seen, there are a lot of breakthrough cases that are occurring, and beginning in about July and August, those populations that were tracked, they started to see lower effectiveness against infection. And this is why we're recommending the boosters as well, to hopefully, again, not only protect against Delta and the other variants, but Omicron as it begins to appear in our population. I know there'll probably be some questions about the rapid tests that have come in. The county is receiving in the neighborhood of 2,500 of these take-home rapid tests and per week from Maryland Department of Health. That's obviously a small number compared to our full population in Montgomery County. We know lots of people are able to go out and get PCR tested either through work or as is happening in schools. So we're trying to make these limited amounts of rapid tests available to populations who are being disproportionately affected by COVID or at greater risk, or have difficulty, would have difficulty coming into a testing site, either at an urgent care or a county site. And so we've been working with our community partners to try to get these tests out to these populations. We do distribute some at our testing sites for individuals who self-identify in these populations. But as the tests continue to come in, we continue to move them out through our partners. We've moved in excess of 15,000 rapid tests out through these partners, and that includes both the over-the-counter take-home ones as well as the clinical version that some of our clinical partners are using to give quick results out to members of the population who don't need a PCR result for travel or work. So those are the updates we have, and now I'd like to turn it over to Dr. Stoddard.
Good afternoon. I have just a few additional comments to make. First off, I want to take a moment of personal privilege and give a recognition for my doctoral advisor, Dr. Drew Weissman, and my benchmate in graduate school, Dr. Caitlin Carrico, who were both recognized as 2 of the 4 Heroes of the Year by Time Magazine this week. This is sort of goes in line with some of the earlier awards they've won with regard to their groundbreaking work on the mRNA vaccine development process. So I would be remiss if I didn't take the opportunity to congratulate them again for all their tremendous work and what they've contributed to making us all safer. On the issue of rapid tests, obviously, as Sean alluded to, we are looking for additional opportunities. We've had discussions with regard to their utilization in other settings, with obviously the numbers that we were receiving still being relatively low, 10,000 in a county population of 1 million plus 2,500 a week. Our concern with making them first come, first served is that they would be swallowed up by a very limited number of residents over a very short period of time. And so we're obviously trying to target the limited resources with rapid testing that we do have to make them, to maximize their benefit in an, as we've done since the beginning, in an equity-based model to try and get it to places where we have more exposures, more risk. And obviously addressing risk in this distribution magnifies the benefit for everyone by trying to break chains of transmission in places where transmission is still occurring. The last thing I want to mention, 2 things I want to mention. So first off, we're obviously concerned about what we're seeing in the school system and in the childcare settings. As I believe was talked about earlier, there's been a 40% increase across the state of Maryland in childcare and school-related outbreaks. Obviously, this comes on the heels of the Thanksgiving break, as well as weather getting cooler and more things indoors. And I think that combination is still going to be with us come the end of year holidays. And so we're obviously deeply concerned about what will happen in a few weeks when students return to childcare and or schools following the end of year holidays. And so that's something we're continuing to pay a lot of attention to. We've been focused a lot on keeping kids in school, but obviously we also are equally concerned about keeping kids healthy. And so that's an important part of this all as well. Lastly, I want to talk about Omicron just briefly. Obviously, we've been very closely monitoring the data that's coming out of not just South Africa at this point, but a number of countries across the world, including the United States, but most notably in Europe with what's happening in the United Kingdom, Denmark, and other places. I think we're still early in understanding, but I think we can draw some more conclusions about the fact that obviously Omicron is transmitting very quickly, and in several places it is outpacing Delta. That is some parts of that are okay, some parts of that are less okay. It does seem to be, and I think we need some more data on this to be less severe. Hospitalizations are there. ICU admissions and oxygenation requirements don't seem to be there as much. Also, there's a plus and a minus on how fast it transmits, in the sense that the peaks of cases are rising incredibly fast, but already in South Africa, we're starting to see the rates of increase start to slow. And so the virus is burning through the population there very quickly. And that obviously means that this particular peak may not last as long as other peaks have, but it may go higher in terms of cases than previous peaks have, just because of the sheer transmissibility of the virus. Now, obviously that has implications, not just in terms of, well, if it goes very quickly, that's, maybe that's a good thing. It is and it isn't, in the sense that we also have to think about continuity of our operations, not just for businesses, but also for the government, making sure that we have enough able-bodied people to continue to provide the services the county government provides, but also our testing, contact tracing, vaccination efforts as well. And so obviously this is something that we're just keenly aware of, in terms of maybe people aren't going to get as sick, but if a lot more of them get sick at the same time, that has its own set of implications. And so we are doing planning around continuity of operations and making sure that we can, have a stable workforce to respond to Omicron, even as it begins to spread. I think the CDC reported last week it was 0.4% of the cases in the United States, and this week it's 2.9. Given the doubling time of 2.5 to 3 days, I would expect that we're going to see that number tick up quite quickly in terms of the contribution that Omicron has on our cases, both in the United States and in the state of Maryland. And as that happens, we'll be very keenly watching what that means in terms of both case rates, but most importantly, hospitalizations and ICU admissions and other things like that. So we are monitoring this very closely and very much paying attention to what's happening in Europe and what that may mean for us moving forward. So I think I will stop there. And I think at this point, we are going to take questions.
Thank you, Dr. Stoddard. Thank you, gentlemen. Let's get started with the Q&A portion. Reporters, remember to make your request on the chat and identify your organization. First, Kate Ryan, WTOP. Good afternoon, Kate.
Hey, good afternoon. Thank you very much. I appreciate this. I'll throw out a number of questions. In terms of the Board of Health and mask metric, we thought, okay, 85%, we'd see that go away. I know that the County Council has said they do plan to meet before the recess is over, before January 11th. What would the new metric be, if there's going to be one? Where are we with announcement of a new health officer? Not that Dr. Bridgers isn't doing a great job, but what's the future hold there? And again, on teams and extracurriculars, can I just clarify what the county is doing right now? Because as of last night, it was any team with 5 or more members or cases would be on pause. Is this going to go system-wide, and will it also deal with other extracurriculars?
So, Kate, I'll start. I'll leave the health officer question to Mr. Elrich to respond to that. So let's talk about the metrics with the Board of Health. So we sent forth a request from me as the acting health officer to meet with the council sitting as the Board of Health to not only reassess, but determine the way forward with the mask mandate. We know that, as Mr. Elrich indicated, and Dr. Stoddard also alluded to in his update, that herd immunity is not on the horizon if it actually occurs, given the variants and the rate that this virus continues to mutate in those spaces where we don't see higher vaccination rates. And so looking at those metrics, we looked at data, science, responses, and planning from California, Illinois, New York, and DC, in those spaces where they have either issued a mandate, rescinded a mandate, instated a mandate to look at those areas. And so we also look at the commerce and the impact on the community that the mandate, a mask mandate has caused. We are not at a space last year where we not only had mask mandates, but we had reduced occupancy in businesses, et cetera. And so we're looking at these metrics to determine not only where we are with Omicron, as Dr. Stoddard indicated. We know that Delta transmissibility is 5 times greater than Alpha, and then you add 2 additional points to that from Omicron, which gives us 7. So Omicron, as Dr. Stoddard indicated, has the capability of transmitting faster and higher than any of the other variants. And so we will take all those considerations. We're looking at epi data. You mentioned the school system and looking at the metrics and looking at case counts and age and unvaccinated folks versus vaccinated folks and the impact that it will have on the school community. So we're taking all those variables in consideration, and we'll present that to the Board of Health for their consideration. We know that there are federal mandates that are still in place, such as wearing a mask on transportation, trains, front-facing places as well. But there are also some businesses now in Montgomery County who have not only coupled with the mask mandate or indoor requirement, mask wearing indoor requirement, but proof of vaccinations. And so that may be consideration looking at the efficacy of what proof of vaccinations are. But in addition to encouraging folks to look at data regarding boosters, Mr. Elrich has asked our epidemiology team to look at the impact that it has on the county, retail businesses and other entities for boosters. What would that look like? What is the efficacy of that? What are we seeing as part of our COVID tracing? We haven't had any COVID linked data from the Maryland Department of Health since November the 7th. So we're looking at data that we have access to, as Mr. O'Donnell indicated in the Pulse update. Whether or not there are other extracurricular activity, we've gone back and looked at data and guidance since May, since sports restarted and CDC has made guidance and changes leading up to where we are today. If in fact there's a need to totally suspend extracurricular activities based on our epidemiology and what our contact tracing and investigation is doing, along with MCPS and the line list that we have, we will make the recommendation to suspend play if in fact it has a overall greater impact on the community and community level spread. We want to keep students in school, as Dr. Stoddard indicated, but at the end of the day, we want folks to be safe overall. So I hope I answered all those questions in that long string.
Gotcha. Well, just to clarify then, we are not where Howard County is right now, which is they've put all sports and extracurriculars on a 14-day pause. We are not there.
We're not there. We're doing it on a case-by-case basis. We've had 6 schools that I've been identified as, and I had conversations with Dr. Rossman as well regarding there, as all of the health officers typically do. We share lessons learned and best practices. So we're looking at that. When we get to that case, we will suspend extracurricular activity, which includes sports, drama, theater, and we will work with MCPS and advise them accordingly. One thing that I know MCPS did was, in addition to pausing play, for those schools where there is play, we know that masks are effective. I know that Dr. Stoddard may have talked about an article that he shared with us where we know that that the efficacy of mask wearing is about 59%. And so we continue to encourage folks to implement a layered preventative measure. So not just wearing masks, washing hands, physical distancing, those are proven practices that we see at the federal and state level, and we will continue to reinforce those practices.
Got it. And how about filling the post of health officer?
It's still in process. I mean, we had a candidate and we were moving forward with the candidate. We were very excited. And then the candidate withdrew, basically citing the climate for health officers in the middle of the pandemic. And I get it. You've seen a lot of health officers leave, sometimes voluntarily, sometimes not so voluntarily. They are majorly underappreciated and become the subject of some pretty harsh treatment. And I believe that that person reflected on that, and given the fact that we're dealing with Omicron, this is not going to go away. It's going to continue to present the same kind of challenges, that they probably felt that they didn't want to be subjected to potentially the level of, I'd say, mistreatment that has characterized a lot of their work around the country. So we have some other good candidates and we're pursuing this. And Dr. Bridgers has done a great job. he worked and, very closely with Dr. Gales. We know the drill. We know, the basics of this virus haven't changed. It mutates, but it still shares its major problems, and there's still the same problems, and we have a consistent way of dealing with it.
Got it. But just to be clear, you do have other candidates you're talking to
Yep.
now. Any
Yes.
possible ballpark timeline?
As soon as possible.
Thank you.
If you ever get a date out of me, you probably should mark that down. And, I have this allergy, that.
Right.
I think, Mark, you feel safe saying it will occur in 2022?
Yeah. There's a date you can count on. Thank you for bailing me there, Earl.
Thank you very much. I appreciate that.
Thank you, Kate. Next up is Tom Fitzgerald, Fox 5. Good afternoon, Tom.
Good afternoon. Thanks for doing the meeting here. A question about the test kits. Sean, you were talking about getting 2,000 a week, 10,000 in all, and getting it to populations that you said were disproportionately affected by this. A question on this. Fairfax County took them, put them in their libraries. People took them home and used them over the Thanksgiving holidays. Understanding that the difference this Christmas from last year is you might have a lot more of a transitory population, people leaving Montgomery County to go see relatives. Could you be a little more specific about who is getting these rapid tests? And could you address a question as to would it make sense to get it into the hands of people that you know are going to leave your county and then come back?
Well, to start with the second question, I think we're probably going to have a number of people leaving our county, and we have numbers of people leaving our county to go to work every day that is far exceeds the amount of rapid tests we have. As far as those, traveling to visit family, it's also going to far exceed the amount that we have. That is certainly, I think, how some people are using it, that we're getting it out to. And that's completely reasonable. But we've seen even around Thanksgiving, a lot of folks in our county do go to come to the county test sites, go to urgent care or pharmacies to get tested before they travel and after they travel, as has been recommended. So we've really just tried to focus on getting these to individuals that because of their occupation, they may not be able to get to a test site when they're traditionally open, or because of increased risks that they may have because of that occupation, or living status. Again, we understand that homebound individuals that we see when we're doing booster shots are unlikely to be able to come into a test site. And so again, we're trying to make these limited supply of test kits go as far as we can and get to people who have been impacted. And we know certain geographic areas and certain racial and ethnic populations in our county have been disproportionately affected, both since the start of COVID, but also are having higher rates of disease transmission within their communities. And so, and we have parts of our small pockets of our county with lower vaccination rates. And again, trying to get test kits out there for individuals who are vaccinated, but live in areas where there's higher transmission makes sense. So as was mentioned earlier, they'll go very quickly whichever way we distribute them, but we're trying to be more intentional with who we get them to.
Dr. Bridges, maybe county executive can take this one. We are seeing some private schools in the region like Georgetown Prep, Good Counsel, altering schedules. Good Counsel is not going to come back in until next year. And I know Dr. Bridges just talked about this being a case-by-case case when it comes to the athletics. But big picture here, do parents need to prepare themselves to the possibility that if we do see this spike come in January, that theoretically we may have to return to a virtual platform?
Oh, Tom, great question. I'll stop and ask Mr. Elrich or Dr. Stoddard to weigh in, because we've been down this road before looking at a phased approach. I know Dr. Stoddard worked extensively with Dr. Gales to develop metrics for virtual versus hybrid versus a return. We aren't there yet. We are working not only with our public school systems, but our independent and private schools to look at those assessments. They have been in contact with our communicable disease nurses to look at the line list and to do the contact tracing. MCPS will begin their winter break next week, which will give us a pause in indoor and classroom environments. Hopefully that will suppress some of the interaction, some of the close contact. Layered preventative measures are always in place. We have modified quarantine practices in place for those who are unvaccinated. And so this time last year, we didn't have all of these preventative measures and tools in place. We continue to push our 5 to 11-year-old vaccinations. But more importantly, the crux of your question is, should parents prepare? They should continue to prepare to have those preventative measures in place, to model those that behavior, mask wearing when necessary, to look at what their children are doing as far as close contacts, and to be able to discuss. We haven't gotten there yet. We continue to assess, as Mr. Elrich and Mr. O'Donnell and Dr. Stoddard have said, on a daily basis for the community level exposure, be it in business practices, be it in schools, be in other front-facing or healthcare settings. One thing that we didn't talk about was or Sean briefly touched on it, was what we're doing in monitoring those congregate living spaces, like our jails, et cetera, to look at those. But to answer your question about virtual learning, we aren't there yet. Georgetown Prep and the other schools may have implemented that, but we haven't had those conversations with MCPS. It doesn't mean that we aren't assessing it and monitoring to make those recommendations, similar to what we did with the pause and play. And so that's the practice that we're going forward with now as we talk this afternoon.
Yeah, I want to really hit the thing that I think Dr. Bridger said at the end there. We've had no conversations with MCPS regarding any suspension or ceasing of in-person education. Obviously, that should be crystal clear. Our goal throughout this has been, so long as we believe we can make the in-school environment as safe as possible, that includes through limiting cases, but also probably more importantly through distribution of vaccinations to prevent even those students who may enter or may develop COVID from having severe illness. As long as we believe that we can prevent serious outcomes for students, we know there is a serious outcome with students not being in the classroom. We have seen that in the data. And so to the extent that we can ensure that there aren't going to be serious health outcomes for students or minimize those potential for that, we can also prevent the learning loss that comes from the remote education. We're going to do that.
All right. You're good, Tom?
Yeah, thank you.
Okay, you're quite welcome. Next up is Dominique Maria Bonesi, WAMU. Good afternoon, Dominique.
Thank you so much, Lorna, and thank you all. I had a quick question. I had a list of schools, the 5 schools that were impacted by the teams at the 5 schools that were impacted by the outbreaks. I have a list, and I have teams for each school, minus Sherwood High School and Sandy Spring. Does anyone happen to know which team was impacted at Sherwood High School? I mean, sports team that was impacted at that school. I didn't get that from MCPS.
Dominique, I don't have that information, but if you send me an email, I can work with our CD&E team to get you that information as we received it from MCPS, so that you can have the schools, the sports. I know that the sports teams that have been impacted have been the boys and girls varsity, wrestling, gymnastics, and indoor track. So I haven't received that information, but if you send us an email, we can respond. I know Ms. Mary Anderson is on the media briefing this afternoon, and so we can work collaboratively to get you that information.
Thank you. And then my second question is just, Dr. Stoddard, I think you said this earlier this month, but these cases in the beginning of the school year, the policy was that any student over age of 12 needed to get vaccinated in order to play a sport in winter and spring. And I don't know what the policy is currently for students. I don't know if kids in elementary and middle school are playing sports within school, but if they needed to get vaccinated, and given that, are we saying that these are breakthrough cases that we're seeing in these schools? Dr. Stoddard, you're on mute.
Apologies. I think after doing this for 2 years, could avoid that. So I think my understanding right now for MCPS student athletes, they're required to be vaccinated to play a sport. That is, I think that is a universal MCPS athletics policy. I do believe, and Dr. Bridges, where I wanted you to chime in on this, is I do believe that the large majority of the cases are breakthrough cases in the case of the athletics-based spread. But I think you have to understand also that there are student participants in the athletics process who are not necessarily the athletes themselves, who I'm not sure how far the policy extends to them. So there are people who are unvaccinated in this process, but obviously the student athletes have to be vaccinated, and there are breakthrough cases in those settings.
That is correct, Dr. Stoddard. So there are breakthrough cases in those settings. Again, Dominique, we've asked our epidemiology team and our CD&E to do further investigations to not only look at those age, since there are now boosters available for 16 and 17-year-olds, which would allow those high school students to get boosters as well. We're looking at where those schools, those cases occurred within Montgomery County by zip code or by our region in the county. We're also looking at whether or not those cases occurred in the county or in interstate play. I know that some travel to some other counties where they may not have the same test to play requirements. And so we also are looking at those data as well. And more importantly, we want to make the assessment by the schools based on the number of teams. We don't know if in fact they occurred, outside the setting. That's why there's also, in addition to the pause and play, but for those schools that are still playing where we haven't seen any outbreaks, that's why in addition to those students, athletes on the bench are wearing masks now regarding that. And so we continue to look at the practices, best practices that we have in place or lessons learned from previous activities. But that's just where we are with the state of affairs. And I guess, again, that it's on a case-by-case basis that we continue to assess. And if in fact we need to suspend play, we are prepared to make the recommendations to MCPS to suspend play.
And just to clarify that point, you said that students are on the bench when they're not playing, are wearing a mask.
Yes.
And correct. And that policy was in place when?
I believe it started Monday. We've had conversations and provided recommendations. So I believe it began on Monday.
Dominic, are you talking about when the policy for the LOA policy went into effect?
The masking policy while on the bench.
Oh, okay. That's Dr. Bridges.
So Monday.
Yeah.
Okay, thank you.
All right, thank you, Dominique. Coming up next, Rebecca Thun, Washington Post. Good afternoon, Rebecca.
Good afternoon. Thanks for having me. My questions are mostly related to COVID-related hospitalizations. I'm wondering if any of the panel members can tell us a little bit more about the uptick in hospitalizations. Who is getting hospitalized at this stage? Are they vaccinated or unvaccinated? And do you have a sense of, are they primarily Delta cases, Omicron cases? How are they contracting the virus as well? And I have another set of questions if I can get a little bit more time.
Sure. So Sean, you want to walk through the hospitalization? I know that we're looking at not only the acute care beds, ICU beds. We know that the original cohort, when we looked at the data prior to MDH's data attack that it was pretty much individuals who were 30 to 50-year-olds, and then it went down to individuals who were, I believe, 20 and older, and hospitalizations for individuals who either had flu-like symptoms or were COVID positive cases who had milder cases. We didn't see the increase in acute. We saw an increase in acute care beds, but not ICU beds, which we've seen over the past week or so. So Sean, any additional data points you can add to Rebecca's question is good now.
Okay. So the going, we haven't had the same data feed, obviously, and I wish I wasn't saying that, but yes, we would suspect that these are still, most of our cases are still Delta variants. And so to answer your question there, that most of these hospitalizations are likely Delta variants. We are, one thing I do want to share, that we have a unique situation in our county, that we have an alternate care site that was opened up during COVID in Tacoma Park, the Adventist Hospital in Tacoma Park. That site is within those units. They are taking only COVID patients, and so they do get transfers from. In fact, all their patients are transfers from other hospitals, which includes hospitals outside of Montgomery County. So some of their patients may be, they may be a facility that is more likely to have patients from outside of Montgomery County, although certainly all of our hospitals have patients from outside Montgomery County. But they are also representing a larger proportion of this increase. And it's very possible that that is because hospitals are transferring COVID patients. So to reduce the risk to other patients in their hospitals, they're transferring them to a unit, which is at Tacoma Park, that is only COVID patients. So that is one of the things that we've identified. Another one is, although the hospitalization data that we shared earlier is inpatients, we track through our syndromic surveillance monitoring all ED visits and factors related to them, and we track COVID-like illness, which are not necessarily individuals diagnosed with COVID, but they have symptoms similar, as well as influenza-like illness. And we're seeing those rates go up, not surprisingly, similar to the hospitalization rates. One thing of note, though, is as opposed to a month ago, we're seeing more ED visits that are pediatric patients with influenza-like illness. So that is certainly on the increase across our county, as represented by our hospitalization, our hospital syndromic surveillance data.
And the last thing, Rebecca, to answer your one question. So the last data point that we have information from is from our December 1st Pulse report, at which point 56% of our hospitalizations were unvaccinated and 44% were vaccinated. Therefore, were breakthrough hospitalizations. And so I think that we don't have the more recent data, obviously, with the December 3rd MDH data issues beginning at that point. Mm-hmm. So it's harder for us to develop the data points from there. So we don't know how it's evolved over the last 2 weeks, but that was the last data point that we did have.
To clarify super quickly, the overall hospitalization rate and the acute care beds and the ICU beds, these are updated, right? Like these were not affected by the data issue. Oh, okay.
It's connecting that to vaccination status that has been limited.
Okay. And then another set of questions is, can you talk a little bit more about, what the trajectory of this bump is going to look like? Is the county expecting and telling hospitals to expect more COVID hospitalizations as we go into the holidays, or is the hope that with an increase in testing and maybe more vigilant mask wearing or the booster shots that this curve will start to bend?
So you've actually phrased it correctly. Our hope is that it will begin to curb. Our hospitalization rates will begin to slow, and our ICU rates will be more limited. But these are both tied to infection rates as they go up. We just hope that we end up with less severe illness because of the vaccination. However, aside from hope, there's also what we prepare for. And the state has issued an update directive to our hospital partners that they needed to submit updated updated COVID plans by today to the state, as well as to look at and start thinking about if their hospital census starts to get to the full side, that considerations would be made to reduce or stop elective procedures, as was done during the first several months of the COVID response across the state and across many states. So we're not at the point where they've done that, but they're certainly, they've been asked to evaluate that and consider, as their rates go up, consider limiting elective procedures. And the state certainly has the ability to tell them to stop it altogether if necessary. We're, of course, we're hoping that it doesn't come to anything close to that.
Got it. And this is given, sorry, go ahead, Dr.
Yeah, I'd like to comment on that a little bit. And not that I oppose the increasing of surge capacity. I think that's important. But I think it's a very much akin to increasing the limits on your credit card repetitively instead of understanding how you can, better spend your resources. So what I mean by that is, I think I'm in favor of hospital surge capacity, but I don't think it should be only hospital surge capacity in lieu of any other preventive measure to control the spread of COVID-19. And I feel like, unfortunately, the state is focused so much on just let's let the hospitals deal with this problem, because we don't want to go back to our population and ask them to do anything more than we've asked them to do at this point. And unfortunately, I just don't think that's a holistic nor fair responsibility to lay at the hands of lay at the feet of our hospitals, given just how much we've already put them through over the last 2 years. We've been entirely unfair to our healthcare partners in healthcare. We often call them healthcare heroes while doing nothing to lessen the burden that they face on a daily basis. And so I appreciate our residents in Montgomery County going forward and getting vaccinated. And I certainly, think that we should, we as a state need to do more to have the vaccination rates look more like Montgomery County, thus not putting all the burden on our healthcare heroes to cover for what will likely be a rapid spread of Omicron through our population and some degree of hospitalizations associated with that.
And Dr. Stoddard, that's a key point, Rebecca, if I may add, because we're talking about the trajectory and looking at the variants and looking at, anticipation of what we will do in response to Omicron's rapid spread, which will take over within a matter of weeks, based on our preliminary analysis and assessment and read of articles and scientific data. 2 points I'd like to add, but as Dr. Stoddard indicated, that not only are we looking at hospitalization usage for acute care beds, ICU, but staffing and the strain and stress that it has caused over the past 22 months to have those available healthcare workers and doctors and nurses and clinicians there to be able to support those individuals who, for some unforeseen reason, are hospitalized. And then looking at, getting folks boosted. We've often said that this is a marathon and not a race. Over these past 22 months is not a sprint. And so looking at getting folks boosted, that's why we have the Boosterama this weekend. Now that we have yet even more age-appropriate vaccines available, we want to get folks vaccinated. We know that the data and the literature clearly suggests that Omicron may present milder symptoms, but those milder symptoms may be correlated to having individuals having a greater immune response. So primary series and a booster. So that's what we're looking at. And that's how we will manage and assess the trajectory and impact of Omicron in the community.
Got it. Thank you all for your help.
Thank you, Rebecca. Next up is Steve Bonnell with Best of Eat. Good afternoon, Steve.
Good afternoon. I want to return kind of to the mask mandate kind of discussions as the Board of Health is going to reconvene soon. I'm guessing the health officials are best poised to answer this, but can you offer any sort of indication about what, if you're going to change it, from the 85% vaccine rate number that we're all fixated on, are hospitalizations coming? You know, we've talked about a lot about hospitalizations. Is that, I guess, what you're going to be looking at in terms of connecting it to it? Is it going to be connected back to case rates? I guess just for residents in terms of what might happen, in terms of what the metrics we're going to be looking at might be. Can any of you provide more insight on that?
Sure, Steve. So our team, Dr. Stoddard and I, and our council, Ms. Kinch, and our CD&E and our EPI team have talked about not only the metrics that we put in place, but we've looked at primary and secondary metrics. So, and specifically looking at those metrics that we will ask the council to consider and assess whether or not, you know, as Dr. Stoddard indicated about herd immunity, and looking at that particular threshold where we are now, but looking at case rates per 100,000 over a 7-day average, test positivity rate, vaccination cover, which would be those primary indicators. Those secondary indicators would be percent change in cases, hospitalization beds to include acute, ICU, and other care beds, and the staffing available to support that increase in hospital utilization should it occur. And then those COVID-related beds, as Mr. O'Donnell indicated at our Washington Adventist in Tacoma Park. And then other factors of those tertiary variables that we will look at is our death rates. If we see an increase in death rate, where those areas are, doing a zip code analysis or census analysis. Also, our reproduction number. How fast is this virus, if Omicron takes over, how fast is it spreading in the community, and where is it spreading, and what's causing the spread? And to assess then, we know that masks are effective measures, but more importantly, looking at the variants, and if there are any additional variants or emerging variants or variants of concerns on the horizon, and then looking at those businesses, as we indicated before, whether or not we recommend businesses have are afforded the ability to continue with mask requirements and or vaccine mandates. So that's some of the preliminary analysis data that we're looking at, indicators that may change, but that's what we immediately talked about. Now, it's only December the 15th and the board isn't meeting until January the 4th. And so they may change based on indicators that we receive now or data that we may review over the next 2 weeks.
To jump in, because we've had vaccines and kind of, you know, more measures and more ways of attacking this virus, is the county leaning toward looking more at hospitalizations versus case rates at this point? I know you just mentioned a lot of metrics to look at, but are we honestly leaning in that direction at this point? Because I know that that's been a lot of the discussion today.
Yes.
Go ahead, Dr. Stoddard, you were going to say something.
Yeah. So first off, I want to make clear that it will be the prerogative of the county council sitting as the Board of Health to make this determination. The guidance that we will offer them is that where are we at as a county in terms of what we're seeing in terms of cases and hospitalizations, as you've noted, and where are we likely to be going, and how would that be impacted by removal or not of a mask mandate. You know, we're trying to give them the best possible guidance from a public health perspective about what the consequences of their actions may be, and allow them to make a determination whether in their balancing of issues, whether they want to move forward with a change or not. Now, the big part of what we will be sharing with them is to talk about the uncertainties associated with the period of time that we happen to be in. Assuming we meet early in the new year, we will have just been coming off that second big holiday break that we've talked about, and we'll be beginning to see potentially the impacts of the gathering that will assuredly happen with families across this and, you know, across the Christmas and New Year's period, and what that will mean in terms of case rate explosions and the like. I do agree with the premise that you raised, that as we get further into vaccinating our population and our 5 to 11 population, a big part of the update we'll provide is how far have we gotten with the 5 to 11-year-olds to understand who is unvaccinated or naive in our population. But as we get further into this conversation, hospitalizations and that kind of metrics should matter more as we move forward. If the illness is less severe, as demonstrated by, you know, not increasing hospitalization numbers, then that should impact how we decide to move forward or how we will recommend moving forward with the Board of Health. That said, there is a lot of uncertainty associated with where we're going to be in 2 weeks, which is why our recommendation, for describing what our recommendation will fully be today would totally negate the next 3 weeks of potential data points, both in terms of hospitalization, but as Dr. Bridges alluded to, Omicron. It is very likely that by the end of the year, Omicron will be the dominant strain in Montgomery County if the projections mirror what we see so far in the US, mirrors what we've seen in Europe and elsewhere. So I think it's just, there's a lot that will change over the next 3 weeks and will heavily influence both the data that is shared with the county council and also potential recommendations. But your point is generally well taken, that as we get further into this response, hospitalization should continue to matter a lot and more, but that we will not negate the considerations of cases, long COVID, and the other issues that we also are aware of.
I think the county executive is poised to take this proudly, but I know, Mark, you've handled a lot of questions about, I know this was months ago, about the vaccine passport regionally being examined. It appears that is stalled. If it hasn't, please correct me, but are you still interested in looking into that with other jurisdictions? Or is that, I just want to kind of get an update there.
I mean, I think at this point, most jurisdictions are nervous about doing it because of the political consequences of doing it. I go to things where routinely they say require a vaccination passport to get in. And then they require you to be masked once you're inside. And frankly, that's the way I feel personally that we need to go. And it's frustrating in this discussion, and with folks on the outside who, focus on when we say like COVID is less severe with the variant. Less severe is a term of art, because almost nobody I know who's gotten the flu or any other cold ever wound up with an infection that was so less severe that they also wound up in a hospital. Most of the time you sniffle for a few days. You drink a lot of fluids, you have some tea, you take headache medicine, and then the flu or other colds pass. Looking at the increasing hospital rates, I get little comfort out of the word less severe. Less severe to me is when you get a cold and you don't have to go to a hospital. And I'm concerned about the pressure potential to put on hospitals. And I think that waiting till something gets so far along that if it truly is going to make a lot of people sick, if Omicron's going to spread the way people think it's going to spread, and people are going to get sick, and you're going to get maybe a lower percentage of people, I think is what our folks alluded to before. You could wind the lower percentage of people getting an infection bad enough to hit the hospital, but that lower percentage could be off of a much higher base of people who actually got infected, which effectively could mean you could have much larger numbers of people in the hospital than you would have had otherwise. And that concerns me. When I look at the data, I forget whether it was the acute or the ICU beds, but there was like a 4-bed difference between who was in the beds and what beds were available. And then there are the other beds, but people have got to realize there are no nurses that you can pick up the phone now and say, hey, we need to upstaff for the next couple of weeks. Would you like to come in and nurse? I've talked to people in hospitals who have lost nurses who have become traveling nurses. They're paying $10,000 a week to bring nurses in just to do base staffing. I can tell you that's economically unsustainable for the hospitals, but it also means that you don't have enough people to service those other beds. So the hospital may have more beds that are available to be acute care ICU beds, but it doesn't mean they have the staff to staff them. And so I've looked very closely at the delta between the number of beds that are occupied and the number of staffed beds that the hospitals have. And I just, I don't understand some people's disinterested in being cautious, given our previous experience with this, is every time we get less cautious, it comes back to bite us. Every time the governor let up, cases spiked. Every single time. It was totally, absolutely predictable. And yet it happened because everybody's anxious to tell people this is over and we're going back to normal. We'll go back, in my mind, you go back to normal when this thing lets us go back to normal, but you can't keep trying to reinvent normal. We're using case rates and accepting case rates that we were closed under before. And now we're saying we're okay to deal with this. So I'm very nervous about, letting this thing get out of hand. I worry about the schools. We'll see where those rates go over the next week. And if it was me, I'd be minimalizing my outside experiences right now. If I was around people I wasn't sure were vaccinated.
There are other policies.
Gentlemen, Steve, pardon for a second. We need to start transitioning behind the scenes for the live budget forum at Leisure World. If you can hold your
one more question about there have been
very quickly, because we have one more from Univision.
Right. Other kind of jurisdictions have done policies like indoor dining vax mandates. Is that something you all are interested in terms of, that's something you have local control over versus the regional passport?
I'm interested. I mean, I don't think you have to, we don't need to do it every place, but I think, the indoor dining is the one place where the masks are off. It's the one place that if somebody walks in there and they're not vaccinated and they happen to get COVID, and we know that you don't have to be symptomatic to be spreading, that you can be a problem and you can infect people. It would be a simple thing. I've said this before. So many people in Montgomery County are vaccinated who are adult and who are dining, that you would lose virtually no customers to do that. And you would get other people to come back to the restaurants. I have this conversation almost every day with people. Everybody gives me the same response. Most of my friends won't go to a restaurant indoors. That's why I can go to the restaurants I like to go to and get a seat on nights and days when I otherwise would be standing in line, because people are not doing that now. So the Board of Health is perfectly free to do that, and I would be thrilled if they did it.
Thank you. Thank you, Steve, for your patience. Up next is Luis Hernandez, Univision DC. Luis, do you want me to read your question, comment, or do you want to ask a question to the county executive?
Oh, it's just requesting a quick comment in regards to the Latino community. We understand that these tests, take-home tests, are going to be very limited, but if you can just kind of give the community a little push to utilize these. We understand that the Latino community is one of the groups that are less vaccinated because of time constraints, and surely they're less, they're getting tested in a less regular basis. So if you can just kind of give a comment, executive.
Look, the Latino community responded very well to getting vaccinated. That's why they have, the highest rates of vaccination, or had the highest rates of vaccination in the county. Everybody needs to understand in that community that as important it was to get the first 2 doses, it has now become equally important to get that 3rd dose. And, I encourage folks to, get that 3rd booster vaccine, because you have less protection now with your previous vaccine than you had a few months ago. And that's not the place you want to put yourself in. You want to be safe. You know that it worked. We've managed to get as far as we can with as little spread as we did by getting people as vaccinated as possible. And it would behoove the Hispanic community to take advantage of it. We continue to be able to make test kits available on a limited basis. And we are looking for more test kits. It's not like we're accepting the limitations of this supply. I was actually texting with a company today that's awaiting an approval about working with them to get more test kits as soon as they get an approval into the county. So I'm hopeful we get more test kits. I hope people, bug us, bug the drugstore, bug everybody you can. It's another supply constraint we're suffering with, but it's important to get tested regularly. You don't want to find yourself sick and then infect folks back in your household or in your neighbors or your friends. So let's keep using the common sense that everybody applied, during the first couple of rounds of this, and maintain the same behaviors we did then. It helped us then, it'll help us now.
And Luis, many of the kits did go to providers for the Latino community, so they should absolutely just engage with their normal provider network to ask if they have available rapid tests.
Perfect. Thank you so much.
Thank you, everybody. Thank you, reporters, members of the media. Pardon the rush toward the end. We're transitioning now to the live budget forum from Leisure World, which is catering to the senior community, the older adults in Montgomery County. Thank you, everybody. Stay safe. We'll see you next week.